So for this exercise, we use a Theraband, and we get just a little teeny bit of stretch. So 2 to 4 inches of stretch. Start with our hands directly overhead, and then we move our arms down in an arc. We go slowly in this exercise. We should take 30 seconds to a minute to complete the arc. This exercise has huge neurological importance for us. If we have chronic or even acute back pain or back injury, often the little intrinsic muscles like the multifidus, interspinous, intertransverse muscles, they get deactivated and they tend to atrophy. We call this disuse atrophy. If a patient suffers from disuse atrophy, they need a neurological stimulus on those muscles in order to get them to, quote unquote, wake up. This exercise, although not really a huge exercise, almost more of a stretch, does incorporate a little bit of tension, which tells the little muscles in the spine that they need to be doing their job, keeping us in balance. The multifidus, intertransverse, interspinous, the rotatories, all the intrinsic muscles in our back are innervated at each spinal level. So if you have an issue at one spinal level, those muscles might not be activated properly. This exercise is a great way to stimulate those muscles and to counteract the disuse atrophy. It's very important to do these on both sides. The other action of these muscles is feedback to our cerebellum, and that helps us keep in balance. So every single one of these muscles at every single spinal level is talking to our cerebellum, telling us where our spine is in space. So you can see if you've lost tone in these muscles and lost activity, you might actually even have lost some of your balance. This exercise can help with that as well, but mostly it's about getting these supportive muscles in our back to regain tone so they can do what they're supposed to do, and that's to keep us in our best anatomical posture. One time, starting from top to bottom, should be sufficient to activate those muscles. As you proceed in your treatment, you can use progressively more stretch and actually get more of an exercise out of this. But at first, we just use this with a very slight pull, very slight resistance in order to activate those muscles. So this is the lightest use Theraband. It is very stretchy, but we're only getting 2 to 4 inches of stretch, very lightly. I like to wrap it around my finger on the opposite side of my hand, keeping my arms perfectly straight when I do this exercise, once again with just a teeny bit of tension. Just that teeny bit of tension is enough to send a huge neurological stimulus up to your cerebellum.
If you or someone you know is suffering from back pain or sciatica, we offer non-surgical treatments that can help your body heal naturally. Call us at 503-684-9698 for your free 30-minute consultation.